Welcome to Section 3 of Unit 1, Pathophysiology of Common Injuries and Dysfunction. You have now covered some of the basic posture and postural dysfunctions and deviations, and we are now going to move on to injuries. As this is such a large topic, we have broken it down into several tutorials to help make it more digestible. You will find some injuries and dysfunctions very common and others rare. The more common ones you'll get to know well, the less common ones not so much. But it doesn't matter as long as you remember they exist and are able to find the right information when you need to. So a basic understanding of the less common injuries is fine. The next section by no means covers all the injuries, but will give you a good grounding. If you move into a specific field, for example netball, you will quickly become aware of what is the sport's common issues. Let's start with some of the common issues you might see. Muscle spasms are very common. I treat a lot of these. They often come about as a protective response to stop you doing something worse. They are often extremely painful and clients will feel they have torn the muscle or worse. A muscle spasm is where the muscle contracts involuntarily and does not release immediately. The duration of this contraction will vary but can be a long time. Cramps are similar in nature. Again, it is an intense contraction of the muscle. Cramps are still not fully understood. Some of the potential causes of muscle spasms and cramps are thought to be ischemia. This is the reduction of oxygen to the tissues caused by the restriction of blood flow to an area. Dehydration is often considered a cause and can be easily solved. Low calcium or magnesium levels. These minerals work together to create muscle movements or contractions and relaxation of the muscle. Low potassium or sodium levels, again, these are required by the muscle to be able to function properly. Glycogen depletion is another possible cause. This is the energy supply for the muscle, and without it, it cannot function properly. Hypertonicity or excessively tight muscles. If a muscle is not in a healthy state, it cannot function properly. So very tight muscles have much less room to contract, so when they do, it may become a cramp or spasm. As I've already mentioned, a muscle spasm could also be a protective response, preventing you from doing further damage. Cramps can come about at any time, awake or asleep during rest or activity. Spasms tend to come on when you are doing something the muscle doesn't like or shortly after. What might present if someone experiences a muscle spasm or cramp? Firstly, pain. This can be anywhere from moderate to severe. The muscle is likely to be in tension in the local area. A lump with a hollow adjacent to it can be found in more severe cases. The muscle can often be left shortened so the limb may be held at a slightly shortened position. Spasms may be palpable and you may feel fluttering in the muscles. Working directly over an acute spasm is contraindicated. You can, however, work around it initially. The benefit of this will help to prevent the tissues around the area becoming overworked, leading them to becoming overtight and potentially becoming part of the problem. When an area of muscle goes into spasm, the muscle fibres around it will have to take the strain at the request for movement. In the acute stage, a client can use heat, which will help to relax the muscle, as long as there is no underlying acute injury. We will talk more about hot and cold later on. Once a spasm becomes a chronic condition, you can treat it directly with massage. Here I will add a note of caution. I have found from personal experience the spasms are often protective, especially in the lower back. So if you're going in gung-ho, your client is unlikely to be able to get off the couch, or within a few hours be in a worse state. I've had 2 clients in my career stuck on couches and it can be frightening. But don't let that put you off. Learn from my mistakes. Simply, don't try to fix it all in one hit. We will talk about this in the workshops in more detail, but all you need to do is release it a little bit at a time. This will bring the client comfort, more mobility and less pain, which is their goal. It will take a few sessions to work it out, or you may find the slight release will allow the spasm to release more by itself. Cramps can be massaged and also stretched, but trying to address the cause is very important. Personally, I wouldn't massage a cramp or stretch it in the acute stage. I might rub it rather than massage it, and I might gently elongate it. The best way I've found of dealing with cramp is by contracting the opposing muscle. If you remember back to your level 3 anatomy and physiology, if you contract a muscle, the opposing muscle must relax. If there is a cramp in the hamstrings, contract the quads and the hamstrings must relax. Once the pain of the cramp has passed, there can often be tightness and tenderness in the area. This is when I would treat properly. Heat can be used by the client as long as there is no underlying injuries. That's cramps and spasms, very similar in nature and generally easy to treat. If someone suffers from them regularly, you need to discuss with your client the potential causes and potential medical intervention. The next tutorial looks at hematomas, which you can move on to once you have completed the quiz for this section.